We are now getting on a call with Dr. Cliff Carpenter, who took my Taking Action Dentist program. So here's our interview and a little bit of highlights of what he thought about it and some of the comments. Well, cool. So let's just dive into it. So Cliff, you took the 12-week Taking Action program of the dentist program that I offer. Tell me a little bit about the program and kind of the processes that you went through.
Well, I think the first step is just like realizing, hey, like I got to get some help with whatever's going on with my neck or my shoulder, my wrist. So the first step, I guess, was just sort of reaching out to you guys and figuring out a game plan. And you guys were like really awesome to just kind of listen to me and my symptoms and what was going on. And then we just came up with a plan together. And the user interface was really nice. The app that you guys sent me was really awesome. And the ability to work just kind of like with my busy life, I guess, to put it into whenever was convenient for me was really helpful. So as long as I was doing, the prescribed work every day, just whenever it was just convenient. So I did appreciate that. And so, yeah, just started getting after it and quickly realized, like I wasn't as like maybe as healthy as I thought I was. So that was kind of like the first eye opener, doing the exercises and being like, wait, I'm fit, I'm healthy. Why does my right wrist not bend as much as my left wrist? Why do I have more mobility on my left side than my right? So it quickly kind of exposed my weaknesses so that we could work on them. And then after that, it was just talking with you guys and saying like, oh, this is what's going on. And then, kind of fine tuning that to help the certain areas that were revealed. So that was kind of my journey. And then like on the flip side, seeing like improvement was really exciting. So
that's awesome.
Yeah.
So as far as if anybody is gonna listen to this, which I won't post the whole thing, but maybe little pieces, tell me a little bit about some of the problems, the pain, the limitation or disabilities that you experienced at first.
Well, I think a lot of my symptoms are really common to my coworkers. We all kind of have, hand problems, wrist problems, shoulder problems, neck problems. And usually it's one side that's sort of affected. For me, it was my right side because I'm right-handed. And I work that kind of twists my whole body out of position. And so, yeah, all of them it's just like a chain all connected on my right side there. So, which really is pretty consistent with a lot of the other professionals I talk to, that, if they work in a similar sort of capacity as I do, that, yeah, we all have kind of the same sort of issues on that right side.
Okay. And were those also dentists or were they other specialties or hygienists or assistants?
Well, definitely dentists for sure. And then hygienists, same thing. I mean, maybe more hygienists would be more in their wrists and hands a little bit more because of the motions that they do that are more repetitive on scaling the teeth. But, the positions are all the same. So very, very similar. Dental hygienists, very similar positions once again. I mean, dental assistants rather, but their positions are slightly different and they're on the other side of the mouth. But I mean, it's all neck, shoulder, wrist, also back. A lot of people have like lower back issues or upper back issues. So I've been lucky not to have too many back issues, but that can also be a thing.
Okay.
So, it doesn't matter who you are. If you're sitting at a desk or if you're doing repetitive motions, you're going to have issues, that come up from those repetitive motions. Even if you're just typing, you're going to have issues. So, yeah, I definitely see it as useful for for everybody, really.
Okay.
So yeah, I also have like an eye doctor friend, and he's got the same issues.
Oh,
It's in a very similar position I do. So, I mean, very similar.
yeah, because I've been to, of course, the optometrist quite a few times. I've never been to an ophthalmologist. I don't know all the specialties, but I imagine they're kind of in that hunched forward position, looking in your eye and documenting over here, coming back, reaching for other things like that.
Yeah. So he's doing eye surgery. So,
Oh,
it's very similar, talking to him. He has a very similar sort of setup with the chair and the way that they position the patient, and they're, he's looking at a very similar part of the face. Maybe some of the angles are a little different, but not too much.
okay.
So he's got to get around sometimes the nose to look at this, and being, one hand dominant kind of puts you a little bit forward with that, whatever dominant side you are on. So
Hmm.
yeah, I mean, I definitely see like a need for professionals, specifically, if you're in any sort of, like you said, a fixed position, a repetitive position. It's going to definitely put strain on your body in an unnatural way that you need to be aware of and
Okay.
work
Yeah.
on.
Yeah. Yeah. And I feel like every program out there, whether it's a professional or a tech, has some sort of ergonomic training. You don't have to go into it all, but how much ergonomic training did you get in school?
I mean, you get like maybe, depends on your school, but not a lot. I mean,
Mhm.
they have so much to teach you, so little time, that it's sort of like get it done, figure out how to do it. And so, yeah, I mean, you're kind of left to your own devices a lot,
Mhm.
trying to figure it out yourself, like looking at what other people are doing, trying to use your own best sort of judgment, like what feels good to you and your body, trying to think about good posture while you're doing it.
Mhm.
So, I mean, you do get a little bit, but it's not enough.
And would you say that the common either dentist or dental professional keeps that in the back of their mind when they're practicing, or do you feel like you all have to take care of each other and be like, hey, shape up that back or squeeze those shoulder blades?
Um, it's definitely on your mind, like especially if things start to hurt, so you
Mhm.
start to think, I need to be better. I need to do something different. I need to get on a program. But I mean, the stress of the day, the flow of the patients sometimes dictates more like the immediacy of like what needs to get done.
Mhm.
And even if you're using your best techniques possible, you're going to get those patients or those situations where it's like, this patient, I can't get them in the proper position for my
Mhm.
body. Maybe they're sick and they can't lay down, if they've got a back issue, they've got a neck issue, and you can't put them in the optimal position. So that means
Mhm.
you have to put your body in a suboptimal position, for that patient at that time. And it's, for to get the work done, to do it properly, to make sure that you're doing the higher, you're keeping your quality of your work correct. Sometimes you have to compromise yourself. And
Mhm.
that's unfortunately a part of the job that happens. I mean, you have those patients. You try not to do those things, but I mean,
Mhm.
they're going to come. You see enough patients, you're going to have those situations arise. So, uh,
Mhm.
it's just sort of a part of the job sometimes.
Now, bouncing off of that, I don't know if it's a common misconception in the dental profession or in dentistry. Do a lot of people feel like doing the job, you're just gonna have pain whether you like it or not, and you just have to deal with it?
Yeah, I mean, kind of. I mean, whether you like it or not, like it is a hard job on your body, and you do kind of absorb some of that. And so, yeah, I mean, it is maybe part of the culture, maybe part of, just sort of what happens, and maybe people aren't talking about it as much as they should, or
Mhm.
being aware of it as much as they should, or not knowing like there are things that you can do So I think maybe it's a little bit of awareness issue,
Mhm.
as well as like, oh, a thought of like, it's not going to happen to me. You know, it's going to happen to the other guy. It's going to happen to my coworker that's going to lose the feeling in their hands. It's not going to be me.
Mhm.
I've had colleagues lose the feeling in their hands and have to stop practicing. So,
Ooh.
I mean, like these things are real, and it is something to be aware of. Like early retirement is a thing.
Mhm.
You know, disability insurance is real. So, I mean, like you want to have that. You don't want to have to use it, but I mean, you should have it because people are, damaging themselves and, you know, through just, I mean, not nothing else besides just doing your job can
Mhm.
cripple you. So, you need to be aware of it. You need to take steps against it. And don't wait till it's too late.
Well, that's what I was going to say. Unfortunately, in the past 8 years or so that I've been treating it, just the general public, one of the most concerning things that I hear a lot is, "I wish I would have met you 10 years ago." And it's like, oh my gosh, I wish the physical therapy or the rehab profession would do a better job at educating the public what PTs can do for them and what might be feasible and what's not normal and what is normal with your body and all that. So that's hard to hear that, especially, you go to school for 8 years to do this, sometimes more. You do your clinicals, you rack up a bunch of debt, and then what happens if you have to retire early? It's like, how are you going to pay for that? How are you going to shift your whole profession, your identity? So that's kind of something that I've been wanting to help out with the dental professionals.
Yeah, I mean, it is a big investment. You've invested your time, your money, in your hopes and dreams into a career. But I mean, on top of that, it's also your life and your body. So more than just making a living, it is your life. It is your body, and I mean, to live your best life, you need to be as healthy as you can. So
Mhm.
you don't want to be one of these people that, hey, guess what? You made it to retirement. Congratulations. But that's only really half the battle, right? Like now
Right.
you want to enjoy retirement. And if you are in constant pain or, having severe disability from your, last 30 years, hey, congratulations, you made it. But at the same
Mhm.
time, you're not enjoying your best life in retirement. So it's like anything else. Like prevention is the name of the game. It's something that you need to do. And so that's why I say, like, it was eye-opening to me when I started your program, because I'm pretty active. I think I'm pretty healthy. I really like athletics. I really like being outdoors. I really like doing hard things, and feeling strong. And so it was kind of eye-opening. Like, yeah, I got some soreness in these areas. It's not that bad. But then when you start doing the exercise, you're like, wait, I can't. I just don't have the flexibility, or this is really painful. So, and it did really open your eyes to that. Yeah, some limitations were presented to me in some of the treatment. So
Mhm.
that was really eye opening to me.
Okay. Great. As far as the program, do you feel like things ran smooth? Do you feel like things were clear and that you could do them in a normal day? Was it feasible for your life?
Yeah, I mean, it definitely was not something that was super hard. I mean, it didn't take all that much time, and I could fit it in when it was convenient for me.
Okay.
So that was really nice with the videos. And I would do it a lot of times just, after the day was totally done and, I had a few hours before bed, I would put in, hey, 30 minutes. And it was great. I mean, like I said, I didn't want to give up those other things that I really do have a lot of joy in doing, rock climbing, working out at the gym, doing my other stuff. I didn't want to have to give those up. And I didn't have to. I was able to do it in addition to everything else because it didn't take over my life. It's not like one of these things that's going to be like, oh man, it was like super hard to do, or took up a lot of time, or had to do at a certain time every day. It wasn't like an extra appointment, which, have a lot of busyness going on besides work as well. So that was really nice. If I would have had to say go to a physical meeting, I mean, it wouldn't happen. I couldn't have been going to physical therapy every day at another location. So I could do it in my own home. The equipment was very user friendly, minimal. So as long as I had a place that I could basically do some mat work, stretch out a little bit, that was it. That's all I needed. And a few basic things of equipment you can pretty much get anywhere. So.
Okay, that's great. We kind of talked a little bit about the accessibility of it and fitting it into your life. What do you feel like there was any challenges about it or barriers you had to overcome when doing the program?
Not really. I mean, I just needed a few minutes and a few basic equipment needs. So I didn't see like a whole lot of barriers. Developing a new routine a little bit was a bit different, but I mean, if it's important to you, it's not really a challenge. And once you do get going on it, I started to feel excited that I was seeing progress. I was seeing more mobility, less pain. I was finding, that I could do more in the gym. I could do more on my rock climbing than I could normally, where I would be having pain in maybe my hands or my elbow or my neck in certain positions, or maybe there were certain lifts I couldn't do in the gym anymore. After I could see myself getting into those lifts again because I didn't have the pain anymore. So that was super exciting and motivating. So once you saw that, it was somewhat like it became, I just got more excited about it at that point. So.
Oh, that's awesome. Kind of shifting the conversation a little bit. You've worked at a few companies, a few different dental practices. Did they have any incentives, or did any of the managers feel like they wanted to really take care of their employees' bodies long-term wise?
It really depends on like the company you work for. I find like with dentistry, you got to do it yourself. I mean, you can't be looking for a company to take care of you, or somebody else. I mean, you just got to take charge of it yourself and do it yourself because you want to invest in yourself. We pay, as dental professionals, you can pay tens of thousands of dollars to say, learn a new skill. You want to do implants, you want to do Botox, you want to do something. I mean, you're going to be putting down a lot of money to do that. So we are, as a industry, like we're used to investing in ourselves. Like that's something that we just do. I mean, we're required to do. And so spending a little bit of time or a little bit of money investing in the machinery that actually makes all of that possible is just really a no-brainer, and something that really is unfortunately overlooked. That, hey, we're going to spend all this time and money developing our skill set. We should be spending a lot of time and money and energy, keeping our bodies healthy enough to employ that skill set.
One of the challenges that I'm seeing is, at least in the Phoenix area or the East Valley in Arizona, is a lot of the dental professionals that I'll go visit and market with. Some of them are already in pain. They're using back braces. They're using wrist guards. How would you feel a stranger coming in here into your clinic and you're feeling vulnerable saying, "Oh, you have pain. I can help you out." How would I be able to overcome those barriers of trying to develop a relationship and build rapport and help this professional that needs it?
There's many approaches to that, I would say. I mean, people that are most motivated are the people who are in pain. Somebody comes in to see me, they've got a toothache, they're my most motivated patient.
Mhm.
They want to simply just get out of pain. So that's kind of, you have something that can get people out of pain. So that's great. Just simply letting them know, like, hey, there are real solutions to your pain. You just need to do the treatment. And, I can be here to help you with that. So that's like kind of step number one. But then two, we do see like I said, it's the prevention. When it's actually painful, oftentimes you're kind of too late. So really helping people see the value of the prevention aspect, like, hey, your teeth don't hurt when you need a cleaning. You just need to go every 6 months,
Right.
Why? Because you want to prevent cavities. If your cavities are hurting, I mean, it's kind of, if you're feeling pain in your teeth, you're kind of too late. So it's the same thing. I mean, you just got to maintain yourself. You've got to take care of yourself now, and learn those skills so that you can prevent the future damage. I mean, when you're having a lot of pain and you're taking time off of work, okay, well, now it's a really big deal. That could have, like you said, I wish I met you 10 years ago. So they're just wishing they had those skills 10 years ago, so that they could strengthen their body in a certain way or stretch their body in a certain way, to gain the strength to hold themselves in those awkward positions, that they wouldn't have had the damage. They could have been just much more functional and healthy. So it's hard. It's hard to convince people of that sometimes, when it doesn't hurt. And what do I need you for? Like, I'm fine. And so when I mentioned, like, that was kind of my first realization was, wow, like, I am, not as strong as I thought. I'm not as flexible as I thought. That was huge. That was an eye opener to me. And sometimes maybe you just have to take them through some basic stretches and things, and let them see, like, actually your right wrist is a lot less flexible than your left. And, you can actually bend your head a lot more on your left side than your right, and like, just kind of show them, like, you're already developing some decreased range of motion, and some problems here. So, that was huge to me. It was just like starting it and seeing that, and then also seeing the results that came after working through it. So that was great.
Oh, that's awesome. And when some people go through pain, like you were saying before, it doesn't just happen over a short amount of time. Usually it develops, and by the time you're feeling pain, at least musculoskeletal wise, it's not too late, but in your guys' profession, it might be too late and you might have to take some sort of treatment. What do you think are some other ways other than stretches or exercises that we can help enhance some of your resolutions of pain or disabilities?
Just so I understand the question, you're saying, like, other than stretches and strength training, what else can we do? Well, like, massage therapy is really nice. Anything that just increases your, I don't know, it's just like the whole strength of the whole body. So I'm not really sure on that one. But
oh, no, that's okay. I was trying to sprinkle in a few wellness type of things that might be able to have a big impact on someone's recovery, someone's mindset when they're dealing with pain. For example, I was sprinkling in some conflict resolution ideas. A lot of dental professionals work in teams, and they have to be on the same page. They have to be able to communicate effectively, respectfully, and at least they should. I don't know if that's the case all the time, but stress, anxiety can really play an effect on your pain and how you deal with it, how you recover. So being able to deal with those sorts of stressful times, whether it's, okay, my heart rate is like 130 right now. I'm seeing 2 or 3 patients. I have my manager yelling at me that I need to get my numbers up. I haven't eaten yet because I'm working over my break. Tactics to be able to just take 30 seconds, take a deep breath, get that blood pressure down, get that heart rate down, take a drink of water, go outside, get some fresh air, get a little sun. Being able to speak your mind professionally and say, I have professional boundaries that I don't want crossed. And I feel like we should set a meeting because I feel like you're crossing them and it's causing me stress. So little things like that. Massage therapy is also a good thing to get the blood flowing, make you feel good. But even hydration, sleep, nutrition.
All of those things are good. I mean, yeah, definitely, eating right, sleeping right is definitely part of it. Stress management. How do you deal with your stress? Meditation, whatever it takes, I would say, like, I did like your mini 5-minute stretch video or whatever that was. It was like the daily stretch. Was that your daily stretch video?
Yep.
I felt that to be one, it was great to do just throughout the day, like if you're feeling tight, but also the movements that you go through are calming. So like, yeah, getting in those deep stretches and like some of the muscles that are really tight during the day can kind of open you up and allow your body to relax as well. Like if you're stretching those muscles that are tight, they can also relax the body and the mind. So, I mean, anything like that you can put into the program is helpful. So yeah, there's a lot there to think about. But yeah, if you're feeling good and you're taking care of yourself, I mean, it just helps everything else. If you're having less pain, if your body and mind's in a better spot, yeah, I mean, you're going to be more successful. You're going to be better at your job. So it goes back into like investing in yourself and taking care of yourself. And so, yeah, this sort of thing is super helpful for them.
That's great. Off the top of your head, do you feel like in your case, since I don't practice dentistry, I'm a physical therapist, is there anything that I might have missed that, like, oh man, this is a great program, it's maybe a 75 out of 100 or an 85? Is there anything that might get me closer to that 95 or 100%, like, bam, I got it out of the park, grand slam?
Well, yeah, definitely definitely we can always improve, right? But I mean, I was very happy with the program. I was very happy with the results I got. I was very happy with the responsiveness of you and your team, and we're being able to work on the app, as well as we could message back and forth. I could show you guys videos of like how I was doing the exercises. You guys just went above and beyond checking on me and making sure I was supported throughout the whole program. So thank you for that. And thank you for including me in this program. Yeah, I mean, yeah, some of the videos, just adding in little commentary to them, might be helpful. And you can kind of throw in some of those wellness tips as part of some of the videos, like during the exercises. So the exercises were great and the videos were great in showing me the moves. Sometimes I wished for a little bit of like commentary or sound as a part of like maybe explaining, as well, the move or the mentality or maybe the mindfulness that goes into the move as well. So, I mean, very impressed with the program, very impressed with the professionalism of it. Totally felt supported. So thank you so much.
Thank you. That's my hope. So yeah, we're very excited to get through the beta testing process and launch it live and get it to as many dentists as possible. Do you feel like, even though I didn't get to see you face to face or put my hands on you, do you feel like any, not professionalism, but do you feel like anything was lost in that?
Well, I mean, if anything was like lost, I think it was probably more of a gain for me and my busy life, being able to do it on my own. And I'm in a stage of life where I've got 3 young kids and a lot of things going on all the time. So being just the access through the virtual was more than sufficient for me.
Okay.
So I did not feel like anything was lost that way. And the way that technology has really just like the connectivity of being able to connect with people is just, it's gone so much better over the last years, and it's going to continue to get so much better than it is even now. So like, I don't really see that as being a limiting factor where, and it's definitely, if there's anything lost by it, I think it's the ability to fit it into your life is totally outweighs it for me.
Okay.
So like, I didn't feel anything was lost by that at all.
And that's such a real thing. We're all so busy with lives. We can't just take an hour and a half or 2 hours out of our busy day to go to a clinic 3 times a week for 6 weeks.
Yeah. I think that's definitely true. So, and you guys answered all my questions, and we can send videos and chats back and forth and text messages. And it was super convenient over an app. You know, my notifications came up every day, and I could plan my week. If I wanted to change something, I didn't want to do it on one day, I could do it on another. It allows you to just kind of customize it. So I felt it super user friendly, super easy to fit into my life. I didn't have any problems with it.
All right. Well, I appreciate you taking your time out and having this Zoom meeting late at night.
Well, it's a pleasure. Yeah. I mean, I really do feel like if I can be an advocate for one professional, or I mean, I don't care who you are, like, but especially, of course, my interest is in dentists. So if I could just convince one dentist to say, hey, like, you got to try it. It's worth it to me, because I definitely have seen the results in me in my life, in dentistry, but also outside of dentistry. I feel like I can pursue my hobbies more. I can feel like I can pursue the activities that the active life I have with my family and my kids more than I could before. So, yeah, remember to invest in yourself as a professional. That's just something that we have to do. And I mean, it's worth it. So if there's somebody, if I can convince one person to try it, then I feel like it's time definitely well spent.
All right. All right. I appreciate that. We're just trying to spread our kindness and our profession to really help out the world one person at a time, and hopefully that trickles and multiplies and everything.
Yeah, for sure. I mean, it's something that like I'm a believer in now, like, because I've seen it. So
Oh, cool.
I hope it does spread to others.
Well, thank you so much for that. And I'll conclude the meeting on that. And any other questions or anything before we call it good?
No, I think we're good for now.
All right.
Thanks, Henry.
Well, thank you so much, Cliff. I hope you enjoyed this dental discussion with Dr. Carpenter. Stick around if you want to hear a little more after our initial discussion.
Yeah,
All right.
I was really impressed.
Well,
I
good.
think you guys got a good thing going there, and I hope you guys can really spread it. You know,
Mm-hmm.
because I mean, it's definitely needful. So I still do some of the exercises and stuff, and I'll probably have to pick up some more. But yeah, I can lift stuff in the gym I couldn't do. Like, I couldn't do deadlifts anymore.
Oh, really?
Yeah, I had to stop totally deadlifting because I was getting elbow pain, like crazy
Oh my
elbow pain.
God. Was that the tennis elbow or the golfer's elbow?
It was the inside
The
golfers.
inside, yeah.
So Yeah, and then like with rock climbing, I was getting pain. And yeah, I was getting pain with my yeah, just the rock climbing, everything was hurting. So but I'm feeling much better. And I did have like whiplash like a couple of years ago with my neck.
Oh,
And so I was in a lot of pain, but I feel like it's totally gone now. But it was like it took like over a year to feel better.
was that like a rear ending or something? What happened?
It was just I fell on my snowboard. Like,
Oh,
yeah, but
oh,
it wasn't even a hard fall. Like it just a really like kind of just laid on like landed on my back real not too bad. But I got like that tingling all through my neck like bad, and then I couldn't bump it or do anything to it for like a year, and it was getting better, but I felt like a lot of the moves and things we did and the stretches really helped that a lot. So
good. And I didn't even have to touch it.
yeah, I mean, I just was trying to follow along with the videos, and
Mhm.
so that was great. And
Well, that's the hard part. It's like, how can I anticipate the life of all the different specialties, the duties you have to do? You know, the hygienist and the dentist are almost opposite is what the assistant has to do. The oral surgeons of having to go forward and wonky and having to create it's somewhat tailored, but it's having encompassed everybody and then
yeah,
all of your life circumstances. So that's really good that you living your life and there's no other Cliff out there. There's no other Cliff Carpenter just like you. So being able to make that program and help you specifically and possibly help someone else in a different situation, it's hard, but also so rewarding.
yeah, I bet. And I think a lot of people are going to have neck issues, a lot of dentists. The only thing I don't have is like the lower back pain, thank goodness.
Oh, good. Knock on wood.
Yeah, I don't know why, but I don't really have like lower back pain. Sometimes if I'm bent over for a long time, like I built like a toy for Caden today, and I was bent over for maybe like 20 minutes. And then when I get up, it's like, oh man, it's really tight. But that's all I got. I don't know. But
Yeah. Yeah, it's usually the things we don't normally do that bam, we go and do it for 20 minutes or 3 hours, and then we're like, oh man, I can't move the next day. Well, you don't normally do that.
yeah, I mean, it's thank goodness it's not the next day. It's just like God, I can't get my back straight. It's just tight, and so that only lasts like 5 minutes, and then I'm good. But
Well, I think what helps out so much is that you're so active and you're very consistent and you have that routine of building your body up. So that really helps you out so much.
yeah, I mean, just like you guys, I'm sure you guys are still like you're getting after it every day, pretty much, right?
Yeah, yeah. But
And
but
stuff.
just imagine all the people that don't have that in their routine.
Yeah, they don't. Yeah, a lot of people just don't exercise. They don't do nothing. I don't know how they do it. For me, if I don't, I go crazy. Like I didn't get to lift today, and I feel crazy.
Mhm.
So I don't know.
I know. We should have done the interview while we were doing some like squats or deadlifts or something.
Something, yeah. I should have
Oh,
done something.
that's the Taking Action Program 2.0. We just came
Okay.
up with a new revolution of
Okay.
okay, we can get stuff done and lift at the same time.
Oh yeah, for sure. Sometimes you just could pick up and squat your kids. I used to do like kettle, like medicine ball throws with the kids. Not against the wall, but like just throw
Catch
like
them.
yeah. See if I can do like 10, right? That was good.
Not against the wall. I like how you had to clarify that.
Yeah, bounce. Just bounce against the wall. You're all right.
Cliff, I wouldn't have assumed that unless you said something. So.
Yeah. Well, I know that you go to that CrossFit gym, so I imagine that's how they do it there. They bounce it against the wall.
Unfortunately,
Oh, yeah, we figure out all sorts
pain
of
kind
ways
of
to
unites us
do
in a
lots of cool
weird
stuff.
way. So if
That's
they're
cool.
in pain and they're ready to take action and do something, if I can figure out ways to make it to where they search, how can I help my neck pain or whatever, and then I pop up, and then our interview comes up or shows me doing something, they're like, "Ooh, okay."
Yeah. Yeah. I mean, it's a thing that people are looking online for it. I mean, a lot of people are on YouTube. They're looking for like, how do I help this? How do I fix this? They're Googling it. So